Good afternoon, everyone. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist with the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Before I get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see them. Please do not share any personal medical information or questions in the chat box. If you have a personal medical question, please ask your doctor. Just pull up your slides. Okay. So next, I would like to introduce you all to our guest speakers today. Today joining us, we have Tiffany Soper. Tiffany has been working with patients to manage their diabetes and other chronic medical conditions for the past 16 years at the MGH Diabetes Center. She graduated from Boston College with her master's in nursing in 2005. Joining us, we also have Briana Kilduff. Briana is a registered nurse who works at the Mass General Diabetes Center as well. Briana went to Northeastern University where she received her bachelor's in nursing. She has been a registered nurse at the Diabetes Center for 2.5 years. In recognition of National Diabetes Awareness Month, they join us today to give a talk on self-management of type 2 diabetes. So please join me in welcoming Tiffany and Briana.
Thank you, Amy. Today, thank you for having us. Today we are going to be having this presentation mostly focused on a patient's self-management of their type 2 diabetes. Let's see. We're going, just want to disclose, we have no conflicts of interest real quick. We are going to be basing our presentation on the American Association of Diabetes Educators, 7 self-care behaviors. We know that working with patients with type 2 diabetes all day, we know how complicated and how many different aspects of your care we're asking you to consider. So we're going to be talking today about healthy coping, healthy eating, staying active, taking your medications, monitoring your, doing some problem solving once you have all your data, and the goal for why we're caring for your diabetes and why you're putting so much attention into your self-care is to reduce your risk. We have the slide starting with healthy coping because we recognize that with all chronic diseases, it is very challenging and very stressful. So we want you to make sure you are getting support from those around you, taking care of being energized, moving your body, thinking positive. There's a lot of research now on positive psychology and how your perception of how well you're doing with your self-care can improve your outcomes, and just being kind and being good to yourself. Briana?
All right, so for healthy eating, you want to have more vegetables, more lean proteins such as salmon, fish, any other fish, chicken. We want to have healthy fruits and drink a lot of water, and other healthy options would be legumes, any other healthy fats, and make sure you increase the amount of leafy green vegetables that you have while limiting the amount of starchy vegetables. So we want to try to do our best to eat less fried foods that are high in saturated fats, highly processed foods that have a lot of sugar in it, like as you can see on the side, donuts or soda, and then beverages with a lot of sugar in them, not even just soda, even a Gatorade can have a lot of sugar in it, juice, and any other foods that have a lot of sugar in them. So My Plate is a really helpful way to visualize. It gives you a visual way to make your plate. So you want to have as much vegetables as you can. It helps to also increase the amount of vegetables and lean proteins while limiting the amount of carbs that you have that can raise your blood sugars as well. And then this slide just gives a realistic, some realistic plates that patients might have for their meals.
All right, and we recognize that what we see in our clinical practice and with talking to patients with type 2 diabetes, diet is often the most challenging part of their self-care behaviors. There's a lot of fad diets out there. A lot of people have can give our patients advice on how they should be eating. And what's important is for you just to find a plan that's going to work for you for the long term. The other aspects of healthy eating is for you to be working on timing your food choices with the medications that you are taking. We recommend strongly that you work with a registered dietitian or your diabetes educator to come up with a meal plan that's going to work for you. Obviously, these are beautiful, healthy, whole food choices that are ideal, but in the real world, it can be really challenging to put together a comprehensive, beautiful plate of food on the table day after day. So there are just many logistical challenges, financial challenges, but the diet is probably one of the most important aspects of patients managing their type 2 diabetes. For type 2 diabetes, if you need to lose weight, that is one of the key objectives of what you should be focusing on with your meal planning. People with type 2 diabetes, even modest weight loss, can have a significant reduction in their insulin resistance and help them lose weight. There was a big study, the Diabetes Prevention Program, and it found that people with pre-diabetes who lost 7% of their weight prevented the progression to type 2 diabetes. This was a very profound impact and for a relatively modest amount of weight loss. So for a 200-pound person, this is about 15-pound weight loss. So it feels, 15 pounds is still a good amount of weight loss, but it's not trying to get down to maybe where you were when you were a younger person. I added this link to the ADA Food Hub. That's the American Diabetes Association Food Hub. This is a great resource for people with type 2 diabetes. It has a lot of recipes on there for challenging situations, like for cooking for 1 or 2 people, for various more vegetarian items incorporating how to incorporate your whole grains into your diet. Another aspect of self-care that we're asking our patients with type 2 diabetes to be engaged in is routine physical activity. There were large clinical trials where they found that 150 minutes of exercise, aerobic exercise a week, significantly reduced the risk of diabetes, promoted weight loss, and it reduced a lot of your cardiovascular disease. The vast majority of the participants in these trials, they were walking. So it doesn't need to be 150 minutes at the gym or running. 150 minutes of walking per week is going to make a significant reduction in your risk of cardiovascular disease and diabetes. They've further looked down into, broke it down, and there were, if you don't have the 30 minutes to commit and set aside for your exercise, they found that if they broke it down into small 10-minute sections, that was just as effective at reducing your risk of complications. So it may be more attainable for after every meal, for example, to go out and take a 10-minute walk. The 150 minutes a week, the thing that I would suggest though is that you try and make sure that you're working a little bit, that you're getting your heart rate elevated. A lot of people are out walking their dog and the dog is mostly going around sniffing the tree or something, and that is probably not going to be as effective. Try to break up those 150 minutes into trying not to go more than 2 days without exercise. And, so that, we could, like every other day going for 30 minutes, or most days going for 40 minutes is going to be, get you to that 150 minutes a week goal. Exercise feels great. It has many benefits beyond your type 2 diabetes, but it seems to me with my patients, it's the first thing that tends to go when life gets busy or you get a cold or something else gets in the way of you being able to stay on track with your targets. I encourage people to think about when they have been more active at different parts of their lives. What kept you engaged in the activity in the past? Some different strategies is choosing activities that are fun for you. If standing on the treadmill is, just extremely boring and you find it like really hard to get on there, maybe you go and do a Zumba class or a dance class. The great thing about the pandemic is that there is so much content online for you to go and find a trainer or a little 20-30 minute class on dancing or Zumba. Other people are successful when they have somebody that they're accountable to. If you have an exercise buddy, a neighbor, a friend that you go on your walks with, you're much more likely to get up and do the exercise rather than waiting if there's somebody that's waiting for you. There's just a lot of technology out there, that pedometers, your cell phones, and I'll talk about this later, but a lot of people are really motivated if they're counting and tracking their steps. Other people are successful if they set targets, like if I do my 150 minutes a week, I'm going to X, Y, or Z. Maybe you're going to you're going to take yourself out to a movie that you've been wanting to see. I don't know. It's a little more challenging with the COVID, but figuring out maybe a little something that you can reward yourself. I do caution trying not to reward yourself with the food as much if you are trying to help this promote weight loss for you. Another strategy, another way to think about the exercise, when you're having a hard time getting out and you are not feeling up for the exercise, the hardest part is just to get started. So for some people, if they say, I'm going to get going, I'm going to go for 5 minutes. And if I'm really still not feeling good, then I'm going to stop. The hardest part is the initial effort of getting yourself ready to go walk or exercise. And so many people find that they are more consistent with their exercise if they allow themselves after to say 5 or 10 minutes, if this doesn't feel good, I'm going to stop for the day. What they found is that the best combination, so I talked a lot about how walking is and aerobic exercise is kind of the foundation for where a lot of this clinical research was discussed on exercise. But probably the best combination for overall health is a combination of your aerobic exercise like walking and strength training. Especially as adults get older, men, their testosterone levels can drop, and so they can lose muscle mass. And there's been a lot of studies looking at women in their 60s and 70s incorporating strength training. What they found was that they had a lot less fractures because they had better balance, they were stronger, and they were better able to, they had less falls. So if you have, if you're looking, you're doing your 150 minutes of walking a week and you're looking to add a little something to that, I encourage you to look into doing some sort of light weights or resistance training to balance out your exercise plan. High intensity interval training, the HIIT training, has been shown to be particularly effective in people with diabetes to lower their blood sugar. So this is where you're doing short bursts, where you're doing a burst of activity such as jumping jacks or lunges. You do that for 30, 45 seconds, take 15, 20 seconds off, and then go into your next activity. The New York Times has a 7-minute workout that I like to recommend. If you have 15 minutes, do it twice, but it's going to go through a series of exercises that's going to target all of your major muscle groups. I always like to encourage people to, when you are starting exercise, to stretch, to care for your body, to reduce your injuries from the exercise. You really want to start low, start slow, and then build upon being successful, because oftentimes it's the getting going, where I've had some patients come back and say that, they went gangbusters and then they hurt their knee and now they're not able to walk at all after they hurt their knee. And then obviously exercise and being active has so many benefits outside of managing your type 2 diabetes. Really great for mood. I think of being active as anti-aging. The more you're doing now, the more you're able to be independent over the long run. The next aspect that's a major aspect of patient self-care is medication management. Many of my patients have multiple times a day that they're taking multiple medications, and it just gets to be very complex. So just some good strategies in general for taking your medications is to I think it's a great idea to keep a list of medications, probably best on your phone. And just in case you have to go to the emergency room, you can share it with your the providers at the emergency room. I also think it's a good idea for you to keep a list of medications. If you have multiple providers prescribing medications, I've frequently seen it where, somebody comes in and an adjustment is made, but the message somehow doesn't get sent over to primary care. So as a patient, taking care of yourself, taking ownership of your diabetes, it's good for you to make sure that you're on top of making sure that all the doses and the medications that they're taking, you have a list of those. We do have a lot of patients on injections, multiple different ways of giving insulin. Just knowing how, if you have questions, work with your diabetes educator or your primary care team. whoever's managing your diabetes, to make sure you understand the timing and how to take your medications appropriately. Safe handling and proper disposal. This is a big, this is an issue with many types of medications, especially if you don't tolerate it and you end up with a pill bottle full of medications you're no longer taking. I think it's probably best for you to contact the Department of Public Health in your town to ask them how to dispose of any unused medications. And then I like to talk to my patients that the best treatment for type 2 diabetes is working on your diet and exercising routinely to hopefully, if needed, promote weight loss. But once we do start adding medications, you know, it's important to know what are the potential side effects. How should I make adjustments? What is this being used to treat? But just being alert for common side effects and when you need to call your healthcare provider. Okay. Here is a list, and I'm not going to really go into how all of these medications work, but I am going to briefly touch base on them. The main thing is there are just so many different types of medications and so many different targets for type 2 diabetes, as it is just a very complex disease. It's affecting many different parts of your body, and there are many different ways to treat it. Biguanides, the main one that's on the market today, is metformin. This is the first line for people with their diabetes. The primary mechanism of action is it keeps your liver from raising your blood sugars higher. But it also works on your muscles so that they are more receptive to taking in your insulin. So the metformin can be taken with food or without food. We generally have patients take it with food in case you do have the side effects. Most common side effects are the nausea, very low rates of diarrhea. So if you take it with food, you might have less of the nausea. The DPP-4 inhibitors, the sinagliptin, linagliptin, saxagliptin, these are often used in conjunction with your metformin. The repaglinatide is a very gentle medication that is taken before meals, and this promotes your pancreas to release insulin. So this one is going to need to be taken with meals, and if you're skipping your meal, you should not be taking your repaglinatide. A new class of medications out there that are being widely prescribed are the SGLT2 inhibitors. These are getting a lot of use after a few studies showed that they were reduced the risk of cardiac mortality in high-risk patients with type 2 diabetes. They're also shown to be protective of kidney function over the long term. This class of medication, the way it works is when your blood sugars are high, it has you urinate out the high sugar. So common side effects are increased urination. What you need to worry about with this medication, this class of medication, is if your blood sugars are high and you're urinating out the high sugar, that puts you at higher risk for there being urinary tract infections or yeast infections. So if you are started on a new medication, Jardiance and Invokana, Faritza, for your diabetes, and starting to have more, noticing you're having more yeast infections or urinary tract infections, please contact your prescriber. The important thing with this new class of medication is that if you're going to have something like a procedure, that you stop taking this medication 5 days before any surgeries or procedures or anything you're fasting for. Sulfonylureas are a very widely used class of medication. These work more long-term to promote your pancreas to excrete insulin. Glipizide, glyburide, glimepiride, those are the main class of medications that are used today. These are important to take with food because they are telling your pancreas, regardless of what your blood sugar is, to secrete insulin. So these are medications that you're more likely to have a low blood sugar on if you don't eat when you're taking those medications. TZDs, rosiglitazone and pioglitazone, these are less common since they showed that there was a increased risk of heart disease. CHF, congestive heart failure, in patients that are on these. These medications work really well for patients on very large doses of insulin to make their body use the insulin more appropriately. So again, there are many different types of medications for type 2 diabetes, and they all target pretty much different aspects of your diabetes control. And so it's just important to know under certain situations like fasting, when you need, if you need to take your medications or if you should skip it that day. There is another class of medications for type 2 diabetes are non-insulin injectables. These are primarily the GLP-1 agonists, and I put a little picture of a Gila monster up here because they isolated this molecule from the Gila monster. This lizard can go in the desert and only eat once or twice a year. So they were trying to figure out how are they able to digest the food, like turn on and off their GI system. So these medications have work on many different things, but the primary way I think about that it works on it is that it kind of slows the food down through your stomach. If people are not as hungry and they eat smaller portions, their blood sugars don't spike up as much. If people are eating less over the long run, then it can promote weight loss. But it's easy to see as it's replicating a gut hormone that people have lots of GI side effects. So we have highly variable responses to our medications like the Victoza is the liraglutide, semaglutide is Ozempic, the dulaglutide is Trulicity, and the exenatide is the Byetta. These are probably seeing a lot of these on the commercials these days for type 2 diabetes. The main class of medications that are used for people with diabetes, for type 2 diabetes, is insulin. I looked up, and when I was preparing this presentation, I tried to look up at the American Diabetes Association, their website, for how many different insulins there are. And they had 27 on that website, but I noticed that there were like 3 different insulins that weren't even listed there. So there are many different types of insulin. Many of them have different profiles, and depending on how your diabetes is being managed, people are on maybe can often be on several different types of insulin. So we have very rapid acting insulins. This is your Aspart and Lispro that you generally are taken before meals. There's short acting insulin like the regular. Medium acting insulin, these are some of the insulins that have been around for a longer period of time. The NPH insulin is the main one of those. Even though they've been on the market and we've been using them for a long time, they're still very applicable in our clinical practice today. There are insulins that you can have that are mixed together with the short and the intermediate acting. And then we have long acting insulins up to 24 to 40 hours. Many different ways to administer insulin. There are insulin, we can give insulin in a pen that's disposable, syringe and vial. There's insulin pumps that are not used as often in type 2 diabetes, in different patch systems where you fill it up with insulin, and then you have to change that every few days. These are all too much to get into for the scope of the conversation for the program today, but it's just, what I would like to take home from this slide is that there are just lots of different types. And what we're trying to do at the Diabetes Center is just match your routines and your patterns to the best insulin in the delivery model that is going to work best for you. And this is just a very brief picture of some of the different styles of insulin pens, disposable ones, refillable. There's a lot of technology out there to make it easier for people to be able to give themselves their insulin as needed. Briana?
All right, so for the main important things to monitor are your blood sugars, and there's many different glucometers and continuous glucose monitors that monitor your blood sugars. A lot of times it's based on what your insurance will pay for, but if you ever need help setting it up, you can always contact us or even your primary care, and we can help set the glucometer up for you, and the pharmacist can help set it up for you when you pick it up before you leave. You should also be regularly monitoring your blood pressure, your weight, and your steps. There's a lot of different apps that can monitor your weight and steps. I know the iPhone comes with a built-in app that a lot of people like. Like Tiffany was saying, there's also different devices like an Apple Watch, Fitbit, different things that can help monitor your weight, your steps. And you can also log in on the apps most of the time, different medical conditions that you have. In case anything were to happen, someone can see all of that in your phone, and you can monitor the different, add in the different medications that you're taking, just so everything's in one place. And I think it's helpful for patients and providers to have that all easily accessible. Like I said, there's a lot of different glucometers, and oftentimes it's just based on what your insurance will cover. So if you ever need help, I mean, a lot of the times you can either ask your pharmacy, call your insurance company, or contact our office, and we can do our best to help figure out. We have a pretty good idea of what insurance cover, which glucometer. So any of those options would be a good way to figure out which glucometer your insurance covers. And so when checking your blood sugar, if you're using a regular glucometer, there are just some helpful tips. You can see in the picture here, the different locations of where you can use to test your blood sugar. The most common area is on your fingertips. We say to try not to go directly in the middle of your fingertip, like on the pad, because there's more nerve endings, so it might cause more pain. Milking your fingers, if you go to test your blood sugar and there's no blood comes to the surface, if you start from the palm of your hand and milk towards the fingertip, it helps to get the blood to come to the surface so you can test your blood sugar. Also, there's a link to a helpful video that me and one of the other nurses here did just to help show you how to set up and test your blood sugars. And then another one, like I was saying, there's like the glucometer, which is your regular finger sticks. And then there's a couple different continuous glucose monitors, which There's different patches, like there's the Libre that the patch stays on your arm for 14 days, Dexcom that will stay on your body for 10 days. And they're continuously checking your blood sugar every 5 minutes for however long the sensor lasts. Again, it's based on insurance coverage, and it would be a good idea to talk to your provider to, one, see if continuous glucose monitor is even a good option for you, and two, if your insurance will cover it.
Yeah, so I would just like to say that the continuous glucose monitors are amazing technology, and we're using them a lot. But it is primarily, for most insurance companies, going to be covered if you're taking insulin 3 times a day. So for our patients who are taking insulin 3 times a day and are testing their blood sugars with the finger stick 3 or 4 times a day, then this is amazing technology to help support them. It is people who are taking a more intensive insulin regimen are probably more likely to have hypoglycemic events. And so these alerts, these continuous glucose monitors are going to be able to be programmed so that they will alert if your blood sugar is going below whatever target you're looking for, usually 70 or 80. These, unlike the finger stick glucometers where it's actually measuring the glucose value of your blood directly, since these are continuously being worn, they are worn on your arm or your belly. And so they are measuring the glucose value of your interstitial fluid. So there is an inherent physiologic, like 10 to 15 minute delay between what you're going to see on your reader and what you would see maybe with your finger stick. So there's all this technology, as we saw before with the glucometers. Even when you're doing the finger stick, the newer ones have about a 7% range of error. Some of the older ones, to get FDA approval, you need to have a 15% range of error with accuracy. So if your blood sugar is 350, you can get readings that are 50 points off, and that is going to be very frustrating, but it's going to be as good as the technology is able to give us for this home monitoring system. So there is some variable amounts of error, but you're going to see, if you test your blood sugar 3 times in a row, a little bit of variability. I encourage you not to do so. I encourage you to think of the blood sugars as giving you an idea more of where you are in what range. So there are, okay. So now that you are working on your diet and trying to understand, what is the best, trying to figure out the best meal plan for you. And now you're trying to exercise and really take good care of your body. We gave you have all these monitors. You can be monitoring your sleep, your steps. There's so much data. There's so much information that you have now at your fingertips with all this wonderful technology. It gets pretty overwhelming. What I'd like to work on with my patients is you taking control, feeling like you're empowered to understand your diabetes. We have all of the monitoring you're going to when you are doing the monitoring, I encourage you to go back and think about what you ate. You can compare, your blood sugars before lunch a couple days, and you can say, okay, well, I ate, an omelet one day with a piece of toast, and another day I had a bagel with cream cheese. If you look at your blood sugar before lunch, you can assess how much of an impact does the food does your breakfast choices have on your blood sugar? Do you need more medication depending on what type you take for certain meals like bagels than for another day where you are eating lower carbohydrates? I don't encourage people to be testing necessarily after every meal because it can get overwhelming, but it is really great compared to other medical conditions where your providers say, here, just take this pill. You have some more tools at your disposal for the pros and cons, where you can take ownership of your diabetes and start to learn when you exercise. Potentially you don't need as much medication on those days. Like if you're going out on an all-day hike, do you need to make sure you have enough food with you to prevent the low blood sugar, but also like how can you adjust your medications for different days and variable activity levels? And I think it's really great to keep logs. So by writing things down, it can really help you start to see the patterns for your different meal choices. It's because it gets very complicated depending on your type of diabetes. Fruit is great for you, but for a lot of my patients, if they eat a big bowl of fruit salad, that's going to make their blood sugar go as high as, a Snickers bar, something like that. So these are strategies and tools that you have that you can start to understand how your activities and your behaviors are having a positive or negative impact on your diabetes. And if you keep your logs, you can bring it in and have one of your diabetes care providers review the information with you and have a second set of eyes to help you making adjustments to your medication, but maybe making suggestions on your food choices. Our wonderful dietitians that we work with, if you're keeping your food logs, they can start to see like what your it's always a good idea to bring in a food log before you see a dietitian so that they can start to see what your preferences are like what foods are you eating that they can kind of build upon. Well, I see that you often have a side salad, so and they can give you suggestions on how to maybe switch your white rice potentially to brown rice to increase the fiber and then get more fiber in your diet. So use the logs and all the data that you have for you to start making adjustments, but you can also bring it in to your diabetes care provider for additional support. And just some specifics about specific areas that I'm often doing troubleshooting and problem solving with my patients is, if you're having a hard time forgetting your medications, a lot of people set an alarm on their phone. Pill boxes are great reminders. You can see if you've taken the medications or not. Oftentimes, the location of where you're keeping your medications are going to help promote, give you a visual cue to remind you to take your medications. I saw one time a coffee mug that said, don't forget to take your medications. And so that would help someone that needs to take their pills in the morning. They're not going to forget their coffee, but they might forget to take their metformin in the morning. Certain special situations and circumstances that we need to think about to adjust medication is since everybody is on a different regimen for their diabetes. When you're fasting for a test or a procedure, should you be taking your medication still, or should you skip them? Sick days is something that I don't have on here, but sick days are really challenging for people with diabetes because the infection and illness can raise your blood sugar. But often people, if they're not feeling well and they're not going to be eating, they might skip their medications. And so I've had a couple patients where they don't take their medications because they're not feeling well, but the infection is making their blood sugars high. And then they can have some of the highest blood sugars when they're not taking their medications due to being ill. The challenging part, but also the good part about type 2 diabetes is you can test your blood sugar. And so you can understand and help guide your decisions to help give you more information to figure out what you should be doing. Exercise. People have highly variable responses to exercise with their blood sugars. This is a good time to be testing so that you can know if you need to take less medication or eat a little bit more food with you if you're going to be doing yard work all day. I've had other patients who, they test their blood sugar before exercise and then test it after. And if they see the blood sugar drop 6 points, 60 points or something, then they, it helps motivate them. They can see right away that when they're exercising, their blood sugars come down. It's November, we have the holidays coming up, there's always going to be celebrations. How do you manage those situations? Are you able to give yourself a little bit more medication, like your insulin before a meal? What kind of food choices? You still want to have the pie, so maybe you have a little less of the stuffing. How do you cope with the holidays and other certain special circumstances? And the reason why we're doing all this and why patients are putting so much effort into their diabetes is to prevent complications. We divide complications into short-term complications and long-term complications. Short-term, your blood sugar can go too low. People get a very strong response when they have a low blood sugar. They can get shaky. It's an adrenaline response. So you can get shaky, break out in a cold sweat. Some people get hungry or headache. If it drops even lower, you can have a mood change or get confused. The good thing about the symptoms of the hypoglycemia is it feels the same every time for most people. And so if you can tell your body is giving you a warning sign, if you're getting a little shaky, have a little bit. If you're having a low blood sugar, it's best to confirm on the finger stick, test your blood sugar, and we recommend having 15 grams of carbs and then waiting 15 minutes and repeating the finger stick. 15 grams of carbs is just a little bit of juice, about 4 ounces is for most people going to bring up their blood sugar. 3 to 4 glucose tablets or hard candy. I have patients that, one patient had like 4 pieces of pizza and a big glass, like 20 ounces of Coca-Cola, and the blood sugar went up to 400 after that. So this person, it's very common that people feel poorly when they're low and they overeat. And so I encourage you to test your blood sugar, give yourself 15 grams of carbs, and then repeat on your finger stick in 15 minutes later. Then going back to the troubleshooting, you want to try and think what happened today. Were you doing yard work and didn't expect to be out so long? Maybe if you are out of the house and don't have lunch at your usual time, did you take too much medication? Perhaps you accidentally forgot that you took your medication and took a double dose. On the other side of that is hyperglycemia, having high blood sugars. So if your blood sugars are running too high for an extended period of time, again, everybody kind of feels different, but the classic symptoms would be increased thirst, increased hunger, blurry vision, increased urination, headaches, fatigue. And then if this goes on for a long period of time, with the blood sugars running too high, your body's not using your sugar appropriately, and so you can lose weight. You know, going back, problem solving, what happened? Did you run out of your medications? And the you're off, you didn't take your medications for a couple days. Maybe there was a change to your medication, like put on a steroid for another medical condition. Eating too much, you know, you usually are active, but you hurt your knee, and so you're working out a lot less, infection or illness. And then just the long-term complications, we want to monitor for those. We want to get the A1C every 3 to 6 months to get the goal under 7%. Getting the blood pressure for most people with type 2 diabetes under 140 over 90, but people for higher risk, we might tighten it up to like 130 over 180. The cholesterol, where people with type 2 diabetes are at higher risk for cardiac disease, so we're trying to pay attention to that and keep the LDL under 100. Routine dental care, yearly eye exams with the ophthalmologist to make sure there's not changes to the back of the eye. You want to be getting your foots checked, and then the yearly urine test to look for protein in your urine. So I rushed through the end part, but I wanted to leave some time for questions. Amy?
I'm sorry, I was trying to, there. Thank you so much. We are now at the end of the session. So if you have any questions for Tiffany and Briana, feel free to enter them in the chat box. So we do have a question. Can type 2 diabetes be reversed?
So type 2 diabetes is just a very complicated condition where you have very strong genetic components to it. So I often see people with a lot of family members have it. So they're just people with going into it with a very high risk. And then you, on the other side of it, it is your environment, how you are, your weight, how you're eating, that the two of those blend together. And then if you have the high risk, and then so if you have the risk from the genes and then your diet and exercise, that's where we find people with type 2 diabetes. So basically, I see a lot of patients with type 2 diabetes who are exercising and eating healthy, and still they need the medications as well to kind of work against their genetic predisposition. But probably most common is people newly diagnosed. So when you are early in your disease, you know, I have patients come in with terrible control. They didn't know they had diabetes. They make major changes, they lose weight. And yes, I have a lot of patients that do reverse their type 2 diabetes, but it's very complicated and it's very individual.
Thank you. Can you explain a little bit about what's the difference between type 1 and type 2 diabetes?
Yes, type 1 diabetes was previously called juvenile diabetes. Type 1 diabetes more commonly occurs in children, like with peaks around 7 years old and 11 years old. It is an autoimmune disease. So in type 1 diabetes, your immune system, the person with diabetes, their immune system is inappropriately attacking the pancreas, so they no longer make insulin. And so it's very specific and disease where the body is in a short period of time in children no longer making any insulin. People with type 1 diabetes need to take their insulin to stay alive. Type 2 diabetes is, we often use and it's really kind of a spectrum. And I also have I diagnose people in their 50s and 60s with type 1 as well. But type 2 is more complex. It's most people with type 2 are more likely to be overweight. So the body doesn't use the insulin very well. And so we need these medications to make it so their body uses the insulin better, or we have to supplement often with type 2 diabetes with insulin. So the type 2 diabetes is more insulin resistance. Your body doesn't have enough, but it still makes some. Whereas type 1 classically is the autoimmune disease.
Thank you, that's helpful. Does eating too much carbs or too much sugar cause diabetes? What is more important to look on a food label? Carbs, sugar, or added sugar?
Yeah, that's a great question. Type 2 diabetes is going to be caused by, it's not caused by eating sugar directly. Type 2 diabetes, you're going to be at higher risk with the genes, but then when you're overweight. So if people are eating a lot of processed foods, I was looking for this study, and just in the last 20 years, our portions have gone up so much in this country in only the last 20 years. So people were eating too much food, eating too much sugar. If you are less active, overweight, that's going to be causing the type 2 diabetes, but not necessarily directly eating sugar. Like if you're eating sugar, you don't have genetic predisposition, your weight's normal, and potentially you're like active, like maybe some kids are out running around, burning off all their energy. It's not the sugar intake directly that's causing the diabetes. It's more the being overweight, which can be from eating too much sugar. The carbohydrates, I recommend, from the second part of that question, I think that it's most important to look at the total amount of carbs when you're reading the label, because you can have foods that show no sugar, but they're going to still potentially have a significant impact on your blood sugar, even if it's not from sugar. Having said that, I think that the sugars in your food are the easiest thing to get rid of. Like for your diet Coke, you go from your Coke, which might have for 20-ounce can, 20-ounce bottle might have 74 grams of sugar. That's like, 2 cups of pasta equivalent. So I think the sugars are easier to remove, but the main thing to look at is the carbohydrates, because those will also include your sugars. But this is, once again, where it is most important that you look at the big picture, your overall meal plan. Like, how much carbs are you eating over the course of the day? Are you spreading out the carbohydrates? We encourage our patients to eat carbohydrates because you need them for energy. It's just how much and how close together.
Thank you.
Mm-hmm.
So we are about that time. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
Oh, if I had to share any thoughts, I would probably say that I feel incredibly humbled working with patients who have diabetes and other chronic medical conditions. It is just a lot of work. I just spent an hour saying all the different things people need to do to take care of themselves. But I do think that it's important, and that, feeling like you have control over your diabetes and control over your outcomes is important for overall health and well-being.
Thank you. Briana, do you have anything you'd like to add before we end?
I agree with everything Tiffany said, and just I feel like building just a trusting relationship with your provider and your team, and just know that they're there for you and everyone's trying to help you. That's really important too.
Thank you so much. Tiffany, Brianna, thank you so much for a wonderful presentation. And everyone, thank you so much for taking the time to join us today. Hopefully you found today's session helpful. As I had mentioned, this session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website. It'll be posted there at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the afternoon.